Hi, we're going to talk about the use of cannabis for glaucoma. Turns out that THC definitely lowers intraocular pressure by 10 to 20 points. That's a big deal. Unfortunately, cannabis products are not available as eye drops. There have been some studies done that show that cannabis in eye drop form can actually lower intraocular pressure, but those forms of purified, sterilized preparations are not yet available. So most of the people who use cannabis for glaucoma actually are smoking it or ingesting it. The American Academy of Ophthalmology has said that this is really an inadequate, poor substitution for eye drops because, first of all, you're affecting all the cells of your body when you really only need to be addressing the eyes, and there's a lot of truth in that. So if you're taking eye drops to manage your glaucoma, there's really no reason to switch to cannabis unless you're taking 2 or 3 different kinds of eye drops and you're having side effects from those, in which case you might be able to replace 1 or 2 of those eye drops with cannabis. Most of the people who use cannabis to control their glaucoma actually do it incidentally. They're using cannabis for other reasons, and it turns out that it's keeping their eye pressure down. Then when they stop using the cannabis, their eye pressure goes up. So if you're one of those people that all of a sudden has glaucoma diagnosed, you might want to think back and consider whether you'd been using cannabis regularly before that time, because it might have been controlling your glaucoma. It has been found that cannabis does not have to be in your body 24 hours a day. The American Academy of Ophthalmology has said it's inadequate to smoke cannabis to control your glaucoma because it only lasts 2 to 4 hours and you need 24-hour control. Well, in fact, many of my patients who come in just smoke cannabis and it does lower their eye pressure. They'll smoke maybe the day before and go see their ophthalmologist. Their eye pressure is still lower. So it must have an additive effect where it's in your system, it stays in your system even though the immediate effects are worn off. And this is just borne out by patients whose eye pressure is controlled with smoking cannabis 2 to 3 times a day. It's actually preferable to use a longer acting form, a tincture or an edible that's going to last 8 hours. And you can even do it at night before you go to bed. I have several elderly patients who don't prefer the actions of THC, but who can use it before they go to bed, an indica strain in particular. And that 10 milligram dose of cannabis at night while they're asleep is actually lowering their eye pressure. Another strategy is to mix it with CBD, and the reason to add the CBD is not to do anything to the eye pressure, but to actually reduce the psychoactivity of the THC. So maybe a CBD THC 1-to-1 mix might be useful for those patients who don't want to experience any psychoactivity, but remember to get 10 milligrams of THC into your system on a daily basis.